Prism for PTSD. FDA-approved treatment adjunct to standard of care. During setup, the therapist will place the EEG cap on the patient's head. A soft, non-sticky gel will be applied to connect the electrodes. Setup time is usually less than 3 minutes. The goal of the Prism for PTSD treatment is to train patients how to control and lower their amygdala-derived EFP biomarker activity level. The amygdala is the center of emotion regulation and fight-or-flight reaction in the brain. GrayMatters Health developed the amygdala-derived EFP, which stands for EEG fMRI pattern, by using advanced statistical models to fuse EEG and fMRI voxel data of the amygdala. Each cycle starts with measuring the local baseline of the patient's amygdala-derived EFP activity in order to calibrate the system, while the patient is watching a noisy hospital waiting room full of agitated avatars. Once the baseline measurement is over, the active cycle will start, where the patient is instructed to make the avatars sit down. The avatars will sit down as long as the patient lowers the amygdala-derived EFP activity. Initially, avatars will stand up and the room will be very noisy. Once the patient is able to lower the amygdala-derived EFP activity by finding the right mental strategy, the avatars will start to sit down. Avatars may get up and approach the reception desk if the amygdala-derived EFP activity is going up again, and return to their seats once the amygdala-derived EFP biomarker activity is back under control. Success is expressed by the number of avatars sitting down during the cycle and the duration of their time in a seated position. At the end of the 3-minute cycle, the patient will be given time to relax before starting a new cycle. During the session, the therapist may remotely monitor the patient's progress on any clinic computer after logging into the Prism system. At the end of the session, Prism presents a full report for debriefing the patient or for the therapist to follow up on the patient's performance. Prism therapy includes 15 sessions. A session is composed of 5 cycles and lasts 30 minutes. Refresher or booster sessions may be prescribed following the initial regimen. Prism for PTSD is an FDA-cleared prescription device to be administered under the direction of a healthcare professional as an adjunct to standard of care. Prism for PTSD. Disruptive, non-invasive digital device therapy for mental disorders.